I would recommend that those who do feel that their child has ADHD go to see their primary care physician and a child psychiatrist. Although there are very few of us in the nation these days, a primary care doc working with a child psychiatrist can be someone to turn to. Although it's really crucial to be followed up appropriately with a therapist, with a child psychiatrist. And these days they even have learning centers that are providing some help in addition to mental aspects, the mental disorder, help with the academics. Raising a child is very difficult, and I'm a single parent with 3 children, so I know exactly what you are going through. You know, sometimes it's tire had a flat, the bills are due, and the last thing you want to do is have a phone call from school. But many of our parents do get multiple phone calls from school, and what do? So we want to try to find the strengths of this child, the weaknesses of this child, and really explore that thoroughly. Sometimes diet can play a big factor, and that needs more studies in order to safely confirm without a shadow of a doubt that this is the cause versus that, dyes, colors, but there have been some implication that certain dyes in the food, red dyes, can possibly cause hyperactivity. Environmentally, lead has been linked to hyperactivity, irritability, mood swings, and should be always checked. And if there's ever been low lead level, let's say the normal, acceptable level, I don't say normal, the acceptable level per the pediatricians in the academic world of pediatrics is 10 micrograms per deciliter. This is where the Center for Disease Control has limited intervention or stated that this is what's acceptable. But any level of lead is not acceptable, and it stays in the bones and the teeth for 20 to 30 years. It comes out in puberty, menopause, and pregnancy, and can cause havoc in a child's brain. Suffice it to say that that is a major problem and one that should not be taken lightly, and look to see if there is an old building. Some of the kids put the paint chips in their mouth and swallow them, which can be devastating, and it can lead to mental retardation, hyperactivity, impulsivity at those kind of levels. But even low levels have been shown in some studies by Dr. Needleman to show that there has been some impact on the brain, and learning disabilities can abound, such as math, reading being number one, spelling, writing. So it shouldn't be taken lightly.